First tonight, a makeup artist from Jersey has told ITV channel she could barely look in the mirror after having a lip job that went horribly wrong. Jo Barron's filler was injected into an artery by mistake.
Now she, alongside many doctors in the Channel Islands, is calling for more regulation in the cosmetic industry. Anna Geary has this exclusive report.
I had to go to work, looking like that. I was really embarrassed. It was... I lost a little bit of confidence and I couldn't really look in a mirror every day. I have to put on makeup every day. So it was really tough time for me.
As a professional makeup artist, looking good every day is part of Jo's job description. So when she went to a Jersey clinic for lip filler injections, it was supposed to enhance her appearance. But the procedure went terribly wrong.
The lady managed to burst the artery in my lip. I was in excruciating pain. I couldn't eat for 3 days, only liquid through the straw.
Jo says she received no aftercare from the woman who did it and had to find a doctor fast. He dissolved the filler and fixed her lips. Doctors in the Channel Islands say the industry is in desperate need of regulation. One issue they're seeing is that non-medical professionals, like beauticians, fly in and out of the island for the day from the UK to carry out cosmetic procedures. They are then not on hand to deal with problems that arise. And islanders are left paying hundreds of pounds for emergency treatment from healthcare professionals who say there needs to be tighter control over who injects fillers.
There's no difference between a beautician and a plumber putting in a filler. None of them are medically trained and none of them have the skills or the capability to deal with problems.
Dr. Curran is a cosmetic dermatologist. I asked him to show me what could happen if fillers were wrongly applied.
We have the facial artery coming down and it has got branches which go across the upper lip and the lower lip. The significance of these arteries, it is your last source of oxygenation and blood to the tissues. And if that's occluded, you will lose a significant amount of your lip. And that is a permanent damage. And even in the best plastic surgery hands, that's going to be difficult to replace.
It is an issue that is being looked at in the UK.
We're currently working with stakeholders to strengthen the regulation of cosmetics procedures.
Jersey's government say they plan to regulate cosmetic procedures, but it's not their priority. While states members in Guernsey say new rules will mean anybody carrying out cosmetic procedures are on a professional register. They say they also plan to make sure that the premises where things like Botox and lip fillers are delivered meet certain standards.
Cases where cosmetic surgery takes place in an inappropriate environment, for a hotel room, for example, and that's what we want to stop.
It's not clear when regulation will come. So for now, Jo is urging islanders to take care when choosing a practitioner for things like fillers. She was told had she not found a doctor when she did, the damage to her lips could have been irreversible. Anna Geary, ITV News.
Well, you can see there the consequences when cosmetic surgery goes wrong can be devastating. Well, someone who knows how dangerous it can be is Ashton Collins from Safe Face, a national register which assesses people who provide non-surgical cosmetic treatments to make sure patients are well looked after. Ashton, first of all, tell us a little bit about how Safe Face works.
So Safe Face is a government-approved register, so we assess and verify each and every one of our members against a stringent set of standards, so the public can be assured that they're in safe hands when they use our register to select a practitioner.
And you're based in the UK, aren't you? But you've just had your first client from Jersey sign up to Safe Face, haven't you?
Yes, that's right. We've just accredited our first clinic called the Columbury Clinic, which is run by a dentist called Daniela Machado, which is very exciting for us.
Now, in Anna's report, we saw a woman from Jersey whose lip filler went wrong, but you've also heard from women in Guernsey as well, haven't you, who've had complications too?
Yeah, that's right. We had a few cases in the last few months where people have been treated by practitioners who are not actually from the island, who just travel over to do 1 or 2 day clinics. And of course, when they experience complications, then they're not available to actually manage those complications. So the poor girls are actually left in isolation, trying to seek help where they can.
It is a worry, isn't it? And of course, this kind of treatment is very popular. What would be your advice to anyone who is looking to get non-surgical cosmetic treatment like this?
I would advise them to use a register like Safe Face. It's the only way that you can be assured that the person is who they say they are. The qualifications they claim are genuine, and you'll be in a safe environment that uses safe products. And
I guess you also see when people have problems and the effect it's had on them, how if you'd have been able to help them, you might have been able to prevent some of the distress they've had to go through.
Yes, exactly. You know, hindsight is a wonderful thing, and I think, you know, many people make decisions thinking that they're, you know, in safe hands and they ask all the right questions, but actually if you are sat in front of somebody unscrupulous, the likelihood is that they'll lie to you and just say exactly what you want to hear, which is why we set up the register.
OK, Ashton Collins from Safe Face, thank you very much for that advice.